Hey everybody. I'm okay. I'm doing a little better. Still swollen, as you can see, with the lips. Face is still swollen. This side is still a little saggy compared to this side. The only difference is this time coming home, and I wasn't going to share this, but I decided to. Because it's weighing really heavy on my heart. I could deal with a lot of things as I was being treated. But as the midnight shift came around, things changed. Attitudes changed. Behaviors changed. And saying that, a young lady that took over, was so bad, I actually still have a bruise on my arm. In the IV, where the IV was, I actually have a scratch. That actually, let me show you all. I don't know if you'll be able to see it, but it actually goes all the way down my arm. I had blood everywhere, you all. It was just a mess. So, I kind of want to go over some things. So, I had spoken to my sister before I even decided I don't like this hospital. I wouldn't even consider it a hospital. You all, and a lot of people, they have bad reviews, but it was the only place I can get to in the amount of time I needed to get to, and because that was the closest place, that was the place the ambulance was willing to take me. So, in saying that, I'm going to tell you what we're going to do. I know some of them watch my channel, you all. So I'm going to go over this. When a patient, you guys don't know what I've done in my past, but for those that have been with me for a while know that I was taking care of elderly at one point in my life. And I have a big problem when people mistreat people, and I don't care or where you are or what facility you work in. And I've turned down jobs because of how they mistreat people, okay? In facilities, even where I'm at. So, therapy, when you answer the phone as a nurse or whether you're in an ER or you're an assistant nurse, therapeutic communication is key. It's very key. Without this, you're not actively listening to the patient and what is going on with the patient. And I'm going to show clips of this is how much they paid attention. I do have my paperwork that I got. Okay? The lady was very rude on the phone and told me I needed to get my ass there, excuse my French, you all, to the ER. That is not how you talk to somebody. That's my first issue right there. You do not talk to anybody like that. I don't care if the person is 6 years old. I don't care if the person is 19 years old. I don't care if the person is 50 years old. And I really don't care if the person's 101. You do not disrespect anybody. In your position, you're not supposed to disrespect anybody. Bottom line. So, the elevation of the face. Okay? Whether you're on the phone and she's taking a message to give to the doctor to call you. This is basically getting the information of what is going on with you so she can report it to the doctor and have the doctor return the call. Well, guess what, you all? That never happened. Before an ambulance was called, I've tried calling since 4 o'clock on to go to him. Yes, they do have outpatient even at night, but I couldn't even get through at this point. Expectations is also part of this elevation stage, and the outcome. Have they been met or not met? The process of the impact, outcome, summative, the two basic formats that they do to evaluate you when you go into the ER is formative and summative. Okay? Kind of similar, but not. But I've always had a golden rule. I have a couple of them. Even as someone that cares for the elderly. And here's my golden rules. Communicate with others as you want to be communicated with if you were in that position or that place, or maybe you have a loved one in that situation. Secondary, treat them how you'd want to be treated. Treat them how you'd want your mama to be treated, or your grandmama, or your grandpa. Don't mistreat them. That is uncalled for. And yes, I'm speaking out because people need a reality check. You know, small towns, small places, you got to realize something. You don't know everybody that comes in there. And you may think you know everybody, but you really don't. You don't have a clue about what they did before they even, went to that facility. Or where they live before they decide to move to your area. You don't know nothing. The other thing I want to talk about. Yes, sorry y'all. I have a whole notebook. The hands whenever they came in the room, she took the information, and this was even before the 11 o'clock shift. Switch over. She never once washed her hands before putting them on me. She did the IV, which she's supposed to flush with a 3 to 5 cc unit. Okay? There's a point to all this, you all. There's usually a cap, a green cap, on most basic standard IV units. An alcohol wipe, in case if they're not using that type of cap, they can always just wipe it off really well when they pop the cap and stop it, lock it, they're supposed to clean that extremely well. Not done. Gloves. The flush, the Curso cap, the alcohol wipes. I'm not using a Curso cap, which is just a little green cap that's on the end of your IV, and that's how they flush the IV. The reason why they need to flush this is because they should not be leaving blood all the way through that IV. Okay? Which happened. Okay? It's to prevent blood clots. So anytime they hook up an IV, they should automatically use a saline flush. 3 to 5 cc's. And they usually do this a little bit at a time, slowly. They don't rush it, etc., etc. And I'll get into more of that as I move on in this conversation. While placing an IV, you should always make sure you clean the area. You never want the blood to build up before and after. This cleaning should be done before meds and after meds. And every shift, usually about every 12 hours. And the green cap is a natural cap. It's a natural IV. Access IV site. Always make sure the client isn't in pain when you put an IV in them. Make sure it's not hurting when you're putting the IV in them. Make sure the drainage is well on the IV. Make sure there's no swelling around where you put the IV. Dressing is properly intact. And if you are one of the nurses that took care of me while I was in your facility, shame on you, especially if you're watching my video. This is very disgusting and disturbing that I even got video of how you people behaved. From point A, I recorded all the way from the ambulance, all the way until I left. The prime flush process. Remove the flush from the package. Remove all air bubbles from the flush. Place aside on a clean area surface or its packaging until you are ready to do the flush. Was this done? No, this wasn't. It doesn't take 3 flushes, whether you are putting flush in or after a medication. First of all, if you're flushing before you medicate and then flushing after to medicate, that's a little understandable. But if you're giving them 3 flushes, that's an issue. On saying that, when you're applying a flush, you should always take your time. When you put that flush on somebody's arm, you just don't boom, done. You're supposed to slowly allow it to seep through the IV. Stop every 2-3 minutes in between to make sure it's working properly. And I don't care if you think you've been a nurse for 5 years, 10 years, 16 years, 20, 30 years. If you're not doing any of this stuff, you're not a proper nurse. And you're not going by proper government mandated laws. Well, I mean, I don't know about you people and where I'm at, but where I'm from, yeah, you would be fired. You always put a fresh cap. You don't ever use the same cap. Could I say that was done? No, it wasn't done. I don't know how you people work or how much you value your jobs. And maybe it needs to start with the upper. Maybe it needs to start with how, you know, the bosses are treating yous. How the doctors are treating yous. Because how that works is this. It goes... Sorry, you all. It goes down the line. So, if somebody is mistreating somebody, all the way down to the nurses. And these nurses are taking care of these patients. Guess who's going to get the sucker end of the deal? The patients. So I don't know what the issue is. If it's with the bosses or the upper bosses. Or the head nurses. Or other co-workers. But how I was treated was a full disgrace. A full-on disgrace. I have bruises and marks that I should not have. I went in your facility already in bad shape. You lied on the intake call. Which you said that I got comfort from a nurse before I called. Wrong. That was never released in my conversation. I never revealed to you where I called and who I talked to or anything like that. So that's a lie. I don't know how you can sit behind that desk and take care of the folks of this county and think, okay, it's okay what you're doing. It's not. They can literally get blood clots. They can get infections. I can go on and on and on. And these people are trusting you with their lives. When are people going to start taking actions for the, responsibility for their own actions? This is very disgusting. I have a 4-part episode coming up after this video that I will be sharing. It's a 4-hour video of me being in the ER before I decided to ask the final nurse to remove the IV before I did so I can leave the facility. Due to the fact and the circumstances of me being mistreated with no proper diagnosis of what it should have been, and I had to go to another facility to get a proper diagnosis. After all this, I think somebody needs to be held responsible. So I'm hoping that this gets corrected. Have a wonderful day, you all. And follow along, because there'll be 4 more videos after this. Bye.